Moving on, scientific research is the backbone of modern medicine. It allows us to understand the human body, the diseases that afflict it, and the ways to prevent and treat them. Public health research is essential for addressing global health challenges. We'll be discussing a significant development in the global fight against COVID-19. The World Health Organization and the SreechitraThirunal Institute for Medical Sciences and Technology, Trivandrum, have recently signed a Memorandum of Understanding under the COVID-19 Technology Access Pool (SCTIMST) program. Today, we have Dr. Anoop Thekkuveettil, scientist, SreechitraThirunal Institute for Medical Sciences and Technology, Trivandrum, exploring the implications of this partnership, the potential benefits for India and the world, and the role of scientific research in combating future health crises.
In 2020 to 22, we have this COVID pandemic. Science and technology help in saving human life. Many technologies have been developed during this period, such as early diagnosis of the virus using PCR and lateral flow assays, RNA vaccine, genome profiling of virus to identify the mutations, etc. Unfortunately, these technologies were often confined to countries that could afford them, and many countries were deprived of access to these innovations. During COVID-19 pandemic, World Health Organization initiated a new program called COVID-19 Technology Access Pool. In short, it is called a CTAP program. The aim of these initiatives were to promote equitable access to key medical products through non-exclusive global licensing and technology transfer needed for the production of these innovations, bring down the price of key medical products, and speed up the access to COVID-19 products worldwide through utilization of untapped manufacturing capacities in different areas of the world, and also provide an opportunity to low and medium income countries to produce COVID-19 technologies themselves and making them less dependent on high-income countries. Also, they were planning to have a potential structural solutions for pandemic preparedness because there could be another pandemic in the line, and such emergencies the countries should be able to cope up with. In fact, CTAP was one of the best initiative of WHO during the pandemic, and all countries were signatories to this noble initiative. WHO was on a lookout for excellent technologies developed by academic institutions so that the know-how can be shared at a faster rate. The technology innovations and basic research at SreechitraThirunal Institute focused on development of an affordable health to people. During COVID-19 pandemic, SreechitraThirunal Institute for Medical Science and Technology developed two major technologies mainly to diagnose the disease. The first one was the RNA isolation kit, and the second was the multiplex RT-PCR kit. COVID-19 virus is an RNA virus, and RNA isolation kit from SreechitraThirunal Institute was developed as a part of an ongoing basic research in the lab. When the COVID-19 pandemic struck the country, there was a severe shortage of RNA isolation kits for PCR test. The institute validated the kit at the National Institute of Virology, and the kit was released in May 2020 at the very early stages of the pandemic in the country. In fact, World Economic Forum listed this kit as one of the most innovative diagnostic strategies developed by India from an academic institution. Multiplex RT-PCR kit was developed to target Delta variant of SARS-CoV-2 virus. The kit was developed targeting one of the least mutated genes in the virus so that the failures of the PCR test can be avoided. Both these kits were validated by ICMR and commercialized in a large scale in the country. WHO in fact approached SreechitraThirunal Institute to check whether our developed technologies could be part of their initiative of CTAP. After a series of consultations and approvals from all government ministries, SreechitraThirunal Institute and WHO signed an MOU. The official MOU was released on 9th of August 2024 at New Delhi in the presence of Honorable Minister Dr. Jitendra Singh and WHO India representative Dr. Rodrigo Ofrin. SreechitraThirunal Institute is the only institute in the country WHO has signed an MOU as part of this Technology Access Pool program. WHO has widened the scope of COVID Technology Access Pool now and renamed it as a Health Technology Access Pool, making the technology initiative to be broader in implications. HTAP has now initiated the discussion with our institute to see whether the technology such as tuberculosis diagnostic kit, which has been developed by the institute, can be included in the system. This year, WHO organized Southeast Asia Regional Meeting in Trivandrum in November of 2024 to acknowledge the contributions of SreechitraThirunal Institute to the WHO's Noble Initiative on an affordable health technology access to every corner of the world. We at SreechitraThirunal Institute is also feel proud to be part of this initiative.
Let's thank Dr. Anoop Thekkuveettil for joining us.